Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Diathermy and the cautery. So first we look at the monopolar. So under monopolar, we look at the flow of the current. So how is the current flow? The current flow, first it goes to the cautery pencil. So there is a cautery pencil. So the cautery pencil to the tissue. So it goes from the cautery pencil, it goes to the tissue, and then it goes to the cautery pad. So cautery pencil, tissue, then it goes to the cautery pad, and then it moves to the machine and the ground. Then it moves to the machine as well as the ground. So now let's look at the modes. So in terms of the modes, there is a cutting. So cutting means there's a low voltage, high amplitude, continuous waveforms. There is a low voltage as well as high amplitude, and it is a continuous waveform. It is a continuous waveform. Next, under the monopolar modes, we saw the cutting, and then comes the coagulation. So there is coagulation. So coagulation, there is alternative waveforms. There is alternative waveforms. So they are nothing but the burst. Next in line, there is a desiccation. There is something known as a desiccation. So desiccation means that there is a presence of the low power. Then there comes a fulguration. So what is fulguration? It is nothing but the high power. Fulguration stands for the high power. Then we move on to the heading of the dissipation. So under dissipation, there is more thermal dissipations of the current. There is more thermal dissipation. The thermal dissipation of the current. So hence can cause the damage to the nerves. So it causes damage. So it causes the damage to the nerves and also some of the other vital structures. Now we move on to the bipolar. So before we move ahead, let's look at during the monopolar cautery, what are the areas which are seen? We will look from the inward to the outward. So moving from the inward to outwards, so what are the structures seen? So first will be the vaporization. So there is a vaporization. Next is carbonization. Then there is desiccation. There is coagulation. Devitalization, as well as the hyperthermia. Now we'll move on to the bipolar cautery. So in terms of the bipolar cautery, it is the flow of current. So this is again the flow of current, and it is only between the tips of the instrument. So it is between the tips of the instrument. So there is less chance of burns. There is less chance of the burns. Now let's look at the modes. So when we look at the modes, it is only the coagulation. there is only the coagulation, and what about dissipation? So in terms of dissipation, there is a less lateral dissipation current. So there's less lateral dissipation current, and hence it is safer procedures closer to the vital structures. Hence it is safer. It is safer in procedure closer to the vital structures. To learn and grow daily like this, please do subscribe.